Welcome to More Than a Therapy Couch, the podcast where we go beyond the walls of traditional therapy sessions. I'm your host, Tianna. In a world that's constantly changing, so are the ways we navigate our mental and emotional health. We're here to embrace the notion that healing and growth extend far beyond the walls of a therapy room. Throughout this podcast, we'll be joined by a diverse array of experts and everyday individuals with compelling stories to help bring awareness to whatever you may be facing. We'll unpack the complexities of the human experience, tackle taboo topics, and challenge the stigma surrounding mental health. So grab your emotional support water bottle, find a comfy spot, and join us as we embark on a journey that goes more than a therapy couch. As a reminder, the topics discussed are for educational purposes only and are not meant to be taken as clinical advice. If you are concerned about you or a loved one's mental health, consult a mental health professional or call SAMHSA's 24-hour hotline at 1-800-662-HELP. So on today's episode, we have Aly Resnick, owner and founder of Tree of Life Counseling Center. So let's get right into it. So May is Mental Health Awareness Month. What does this month mean to you personally?
Mental Health Month isn't just 1 month. I feel like it just extends to every month. And I think every month is Mental Health Month. So for me, May is just another month. But I do appreciate the fact that mental health is becoming less of a stigma and that people are recognizing it more and taking it seriously.
Do you feel like you've seen that in your professional field, that people are starting to talk more openly about it?
Yeah, I think just in general, people are starting to talk more. I think it's more in social media. They're making movies about it, documentaries, so people are aware of certain things, which is really nice.
Absolutely. And why do you think Mental Health Awareness Month is still so important today?
I think because there's still some people that truly don't believe it or don't believe that there are people who suffer. They think, oh, it's just a personality flaw, or there's really nothing wrong with you. You're not depressed. You're lazy. But that isn't true, right? People do go through things. So I think it's nice because bigger agencies and bigger companies make a big deal about it so that it brings more awareness, and it also creates more research and funding so that they use that to help with medicines or different programs for people, which is really nice. Community programs always do stuff. So I think it's awesome.
And so as you're explaining this, you mentioned big organizations. One of the things that we've talked about on some of our past podcasts is how some school districts don't offer certain support to some of the students in terms of mental health. I know for me personally, in the town that I grew up, it was very much academic based. And not to go off script a little bit, but I'm going to tell a little story. I was actually at a coffee shop a couple days ago, and there was these two girls sitting next to me. And naturally, because I'm a people watcher, I'm like, what are you guys talking about? So I'm doing my work, just listening. And the one girl says, with the school that we grew up in, they didn't really talk about mental health. And I was like, interesting. And she goes, and if I knew that I could have went to a trade school, I would have totally went to a trade school. But all they cared about was our academics and our grades. And she ended up shouting out this one English teacher who at the time very much was talking about college essays and this is what you need to do for the class. And this teacher knew that she didn't want to go to college. Mind you, I love that I picked up this whole entire story from me sitting next to them. But she explains to her friend how the teacher said, listen, I know you don't want to go to college. You want to go to trade school. So let's do a project. And for you, do it on if you were going to have your own business. What would that look like? What would your day-to-day kind of be like? So all of that being said, her other then friend responded with, oh, well, I really wanted to get into FIT. And my academic counselor actually told me, well, you'll never get into FIT. And the girl responds with, well, I got into FIT and look at me now. So I think even just that being said, we've talked about this before, meeting clients and meeting people where they're at. And I think people don't know about those resources, partially because some of the school districts aren't providing those resources to the students.
Yeah. It's beyond schools. It's doctors. It's everywhere. Nobody provides resources. Like the kids suffer in school. I remember, I mean, granted, I'm a lot older, but when I was in school, there was a kid who suffered from ADHD. It was, now I think back and it was quite obvious, right? He was just labeled as the bad kid, right? And, you know, they didn't do anything to help him. They just yelled at him all the time. Literally, I remember this. And he got in trouble a lot. Instead of providing resources, helping him, taking him out of the classroom, giving him something to play with, something like a fidget or something. So I think the school districts do, I think, the best that they can with what they have. But I still think that there are limitations everywhere. And I think they're doing a great job now of doing like in-services and saying like, hey, these are the resources that are available, but we could be doing more. We could do better. I was somewhere, I don't remember where. Oh, the doctor's office. And I saw a poster somewhere and it says like, are you suffering with like mental health? And I was like, oh, okay, thank you for finally bringing that up, because, you know, I know that we've talked about different places to market, right? Like, and people don't realize that everything you do can affect you, right? So like if you're going to just a doctor with your parent, right? Think about like, if you're hearing news, that could affect you. Maybe you need some help or support or whatever, right? Like you just never know. So I feel like they're doing a better job, but we could be doing more.
100%. And from your experience, do you feel like there's still a lot of mental health myths and misconceptions?
Oh, yeah. I think now with TikTok, people love to say, I have ADHD, ODD, OCD, PTSD. Okay, well, let me just tell you, you don't have any of those things. And you might, and I'm not discrediting anyone who does. However, I think that sometimes now that people are starting to talk about it a lot, now it's becoming this thing where everyone just rattles off their diagnoses, and it kind of discredits the people who truly do. However, you know, it's good that people are becoming aware of it. So, double-edged sword.
One of the misconceptions that I've definitely heard a lot in my life is, well, I don't have anxiety or I don't have depression. Why do I need to go to therapy? What would be your response to that?
That's great. Maybe right now you don't, but wouldn't you like to build the skills so that in case you have a situation that comes up, you are prepared? I always tell people therapy is a toolbox. So I give you the tools, and just like a regular toolbox, when you need them, you take out your hammer, you take out your screwdriver, and the other tools that I don't know the names of, right? But like you take those out as you need them. It's not meant to be oh my God, I need all the tools at once. That's just, I mean, I don't think that happens. If it does, sorry, people in construction.
So let me ask you this. If you could wave a magic wand and change one thing about how society views mental health, what would it be?
Oh. It's a heavy question. I feel like there's so many layers to that, but I feel like I would help people navigate to what they actually need, right? So like there's a lot of parents who recognize that their kid maybe have some depression, anxiety, whatever it is, right? And they say, oh, here you go. And then after like 2 or 3 sessions, oh, they're fine. But they're not. Like you're not paying attention to the right things. And sometimes we can only fight so much to advocate for somebody, but it doesn't always work. And I think if I was able, and it's not just for parents, it's, you know, anyone really, if I was able to help them see that sometimes things are progressive and it takes some time, that would be amazing. That just because you've come twice doesn't mean like you're fixed. We get a lot the question of, well, how long is this going to take? I don't know. It might take a year. It might take 10 years. It might take 3 months. It's really dependent on you, what you're coming for, and how much you're willing to put into that.
Absolutely. And I think too, if you're coming to counseling, you may come for anxiety. And then when you're coming for anxiety, maybe something happens to you during that time that's traumatic. And now you're working on trauma.
Yeah.
Right. There's a lot of different things that can happen that changes what's going on with you. But I love how you phrased it before of coming to therapy is just your toolbox and you're able to fall back on these resources anytime that you need that. And sometimes your old toolbox, you may break a tool, you may lose a tool. And that's why you continue therapy, or you try a different therapist or a different approach so that you can then build that toolbox back up again.
Sometimes you forget how to use the tools. You just need a reminder, and that's okay too.
And you need someone to like guide you, like a tutorial type of thing.
Tool tour guide.
Exactly. Exactly.
We're coining that phrase.
As you mentioned, a lot on social media and things that people are talking about, people may just put like, perfect example, a couple days ago, because we're filming this in April, for May, it was semicolon, I think awareness day or semicolon day, just in general. And some people were just reposting a semicolon or reposting a quote. How can people actually take action, not just post a quote on Instagram or repost something on Twitter?
Sure. So reach out to someone who you know maybe a little bit depressed or has a history or maybe going through something. Reach out and say, hey, want to grab some coffee? Hey, how you doing? I'm just checking in. It doesn't have to be anything crazy, but just send a text. Hey, checking in. Hope you have a great day. Donate to one of the donations, NAMI, like one of the foundations, right? Donate to one of them. Volunteer your time. Anything, literally anything. Host a drive, host a GoFundMe for someone who's, going through something. Share their story if they give you permission. Anything. Go on a podcast, and support the podcast that's supporting, whatever the cause is. Any of those things.
Absolutely. And I think there's so much to be said about if each person just did one little thing.
Yeah.
The world would be maybe a little bit kinder.
I say that all the time. Smile to someone. Just smile at someone. It's not hard. The other day, my mom and I were driving, and there was a person who just like drove by and waved at my mom and I as they were driving. And my mom and I were like, oh my God, that was so nice. And then a few minutes later, we both looked at each other at the same time and said, isn't that sad how this one little interaction made our whole day. Yeah. It was sad because it's it doesn't happen that often, but it was nice. It was just wow. So imagine if you just smiled at someone once every day and just said, have a great day. How hard is that?
Exactly. And there's been times if you're going to a coffee shop in the morning, compliment the barista, compliment people, because I mean, at least me, I'm a firm believer of whatever you put out there will come back to you. So if you hold the door open and the person doesn't say thank you, okay. As Mel Robbins would say, let them.
Let them. But I'm the person that would go, you're welcome. Hope you have a great day. It's not sarcastic.
I always wish I could say to someone, especially, I'm sorry, I'm going to be honest. We know in customer service, you work with certain people that are a little bit harder to navigate. Yeah. And I so wish I could use the line of have the day that you deserve.
But so I did that once. I worked for a large healthcare organization. We will not name them. And my job was to provide therapeutic services to people who were in need and over the phone. And basically we were cold calling essentially at this one point in my job. And we were calling people who had certain diagnoses. So they were coming out of the hospital, etc. And this person answered the phone and they were just coming at me. And I said to them, look, I really understand. It's really annoying. You're getting all these calls coming out of the hospital. You've just been diagnosed. You're inundated with all of this. And they understood. They did. And they were like, I get it. And I was like, I'm just trying to do my job. I'm sorry. If you don't want this service, I get it. Just tell me the words and it will be done. They couldn't hang up until they told me that, essentially. And they just started berating me. And I, again, just kind of de-escalated. And I stayed cool, calm, collected, which is not like me. And all of a sudden, they said something that was so offensive to me. And I was like, that's my breaking point. And I was like, you know what? I really am sorry you're going through this. And I wish so much that I could be a support for you. But at the end of the day, I'm going to hang up. I really hope you have the day that you deserve. And I hope that things get better for you. I hung up. Within like 5 minutes, my supervisor calls me on the phone and says, "Hi, can we have a conversation?" She laughed and was like, I mean, is what it is, right? I mean, but at the end of the day, even that wasn't that terrible. It's a nice way to be like,
I mean, listen, if you have the day that you deserve, if you're offended by that, then I think that says a lot more about you than it does about
100%.
me.
I'm not telling you anything like I'd want to say. You know.
Exactly.
But hey.
But we are going to take a quick sponsored break and we will be right back. Feeling stuck mentally and physically? It may be time to supplement your self-care practices with some holistic healing options. Mind the Body Holistic Wellness in Freehold, New Jersey proudly offers a variety of healing modalities, including Reiki, massage therapy, reflexology, and Himalayan hot stone massages. For more information or to book an appointment, visit www.mindthebodyhw.com. Now back to our show. Welcome back. So, what are different ways anxiety and depression can show up in people's lives?
Oh, so many ways. I think people stop doing what they love. They treat people differently. Like they may not appear the way they normally do.
Mm-hmm.
They could stop them from going to work, going to school, doing anything really. That's really depression. Anxiety can just paralyze you in any moment, make you view the things that you once looked at as like positive things as maybe like things that are not safe in the moment, which is hard.
It definitely can be hard, especially if something used to feel safe or you used to feel a certain way and then you don't, it's not like you used to feel one way and then the next day, I mean, depending on certain circumstances, that could be the case, but it can definitely happen over time where I feel like you as the person may not even realize that it's happening.
Yeah. It's like an overwhelming fear. I always think of like airplanes, right? Like people are so afraid to fly, or 1 minute they're okay. And that's not really 1 minute. It's like all of a sudden, something happens. And now it's, I can't. Like my best friend, love you, Marina. We would fly all over the world together, literally. And now she has a fear of flying. And so we haven't gone anywhere because with all the things that are going on in the world, in the air, she's afraid that the airplane's just going to fall. And I keep saying to her, yeah, but there's all these other things. And she's scared and she can't get past that for right now. So we'll work towards that. But that anxiety takes over. And when she starts thinking about it, her chest gets tight, it's overwhelming, and she starts to panic.
And if someone has experienced that same type of feeling, when would you say it's time to ask for help, or how would they know that what they're feeling isn't just a rough patch?
Well, even if it is a rough patch, it's okay to ask for help, because even if you experience one small thing, that doesn't mean that 6 years from now, 10 years from now, a month from now, you won't experience that same thing, but it might be on a greater magnitude, right? So I feel like it's always good to ask for help before. Like I always use the example of if you have a headache, right? You're not going to take the Tylenol while your head is like literally pounding. You take it as soon as you feel a little bit. So that way it kind of dulls the pain. It's the same thing. You would just kind of ask for help when I start to feel like the things that I love are now scaring me, or I feel like this tightness in my chest, or I feel overwhelmed by things, or the things that I used to love to do, I am slowly starting to pull away from. My friends are kind of not hanging out with me anymore, or really like I don't want to hang out with my friends anymore. Sometimes we'll notice that.
And has there been a common theme as to why people are seeking treatment?
So I think most recently the political climate has really increased people's want and need for treatment, especially for anxiety.
Mm-hmm.
They're experiencing a ton of anxiety with the unknown of what's going to happen, what is happening, what that looks like for them now in the future. Like people are just not really sure what things are. Um, Lately, we've gotten a lot of requests because of there's this fear that there's going to be like World War III and what that looks like, and especially for the LGBTQIA population. There's also the sense of like insecurity
Mm-hmm.
of like what's next, what does that look like, or my rights being taken away. And while we can't give you the future because we're not fortune tellers, I wish I was, but we can at least help you, guide you, and give you support in this moment. But
Mm-hmm.
that's a big thing that we're noticing.
And
burnout.
I love that you mentioned, I mean, I hate that you mentioned those things, but I'm glad that you mentioned them now, just because even like myself, like everything that you just mentioned, that's literally my demographic. So being someone that not only like works in marketing, so I'm constantly always on social media, always on news sources and everything like that. Everything is so being thrown at you that you can't even like comprehend all the things that are going on. Like, what do you mean we're only in the middle of April?
Yeah.
Like what do you mean? Like, it's only been 3 or 4 months.
Seriously.
So I definitely, unfortunately, can understand why a lot of people are feeling that right now. But I think it's definitely nice that you guys are offering support for clients who are struggling during this time. Would you say that there are specific tools or approaches that your team finds helpful?
From what I've heard, like in peer supervisions and kind of in just supervision, a lot of the clinicians are just using like a lot of DBT skills, which is kind of like mindfulness and kind of helping people like ground to where they are in the moment.
Mm-hmm.
So kind of staying present and focused where we are. Because if we go to the what ifs, anyone will go crazy, right?
Mm-hmm.
Like it's too much. So if you just stay in the here and the now and focus on what's now, it's helping people to become a little bit more grounded. And to be honest, a lot of people are also utilizing med management, even if it's, just temporarily based. It kind of helps you kind of get a base, and then we can teach you skills and things while you're kind of at a base. Then you have those skills, and then if you come off your meds, which is totally fine, as long as the provider says so, right? But if you come off, now you're at this point where, okay, I have a skill set and I know what that looks like. Now I can go off that.
It's kind of like medication gives you that boost of feeling stable so you can learn the tools, so that then you can practice those tools. And then once you're stable, it's like, okay, let's start to explore what it may look like if you're being tailored off. And I know that's probably one of the biggest questions that I've heard with the people I've talked to is, okay, if I'm on medication, do I need to be on it for the rest of my life? And if I do, what does that look like? Does, as a woman, does that affect, fertility? Does that affect this? Like all of these lovely questions, which again, like the same way that you're, 18 and have to figure out what you're going to do for the rest of your life. How are you supposed to know these things in like your early 20s, your mid 20s, if no one tells you?
Ask questions.
Mm-hmm.
That's one of the things that I do with the people that I see is I empower them to ask questions.
Mm-hmm.
Advocate for yourself. Ask a question. It doesn't matter if it's mental health, anything.
Mm-hmm.
Just ask.
Mm-hmm.
How does this do this? Why am I? What?
Mm-hmm.
Ask the 5 questions.
Am I supposed to be experiencing this?
Right. There's people, because I work closely with the prescribers, and there's people that, will say, oh, I've been experiencing rashes and, X, Y, and Z for like, a couple weeks. Why didn't you call us? Call us.
That's not normal.
Right.
That shouldn't be happening.
Tell us. We'd say if there's anything abnormal, tell us. Call us. And they're like, oh, I didn't realize. Well, call us.
Like, we're here to help.
Right. The worst we could say is, no, and I don't think that's us, but, will at least guide you.
Exactly. And give you some type of comfort and to knowing what direction, because like you said, as you get older, unfortunately, all of us need to go to more doctors and
100%.
on more medications and for all different things.
Yeah.
But I think that's definitely something to making sure that you're advocating for yourself, making sure that you know that you can ask for these things. And there's nothing wrong with that.
No.
So speaking of advocating for yourself, what would you say to someone who feels ashamed or nervous about naming their anxiety or depression out loud?
That's okay. You don't have to, right? We can just talk about anything else. You don't have to say, hey, I have anxiety. You don't have to give it a label. Just talk about the symptoms you're feeling.
Mm-hmm.
I had actually a client who she named her anxiety. I can't say the name, but we'll call her Phyllis because I don't want to shout her out. So she named her anxiety. Let's call it Phyllis, right? And she used to come in and say, oh, Phyllis was a B today. And I'm like, what happened? And then she would explain and I'm like, okay. And I once called her out and I said, why don't you ever say my anxiety? And she said to me, oh, I can't say that out loud. So it's very much like this, right? But instead of shaming herself, she gave it a name.
Mm-hmm.
Totally fine. Give them a name. Name your symptoms. Totally fine. It's your treatment.
Mm-hmm.
It's your body, your choice on how you fix it.
And more and more people, this relates to burnout. So more and more people have been talking about high functioning anxiety and depression. What does that actually even mean?
That means operating at a point where you're constantly in fear of one, disappointing yourself or other people, doing the wrong thing. So you're constantly overdoing it, right? Like doing your job and 10 other people's jobs, right? Because you don't want to disappoint someone, or working extra hours because you need to get it all done because there's impossible deadlines and things, right? Like that's what that looks like. It's to the point where you're so overwhelmed that whatever you're doing takes over, right? Where you can't process or have a conversation, just normal feedback. You take it as like, oh my God, they're attacking me, because you're so like overstimulated in those moments. And it's because most likely you're an incredible human, right? And you have an incredible work ethic, and what you have to offer is insane. But you have this expectation of yourself and everything that's so high that you don't know how to like bring it down a tiny bit.
And you set that bar so high that when you don't reach it, it's like, well, now I suck at everything and I'm a failure.
Yep. And it's just like this horrible cycle, and it starts all over.
So with that, do you know anyone in your life who's struggling with this?
Of course. I mean, I think I love them all, but most of my staff, I have to be honest. I think therapists are so empathic, and we just go through this like where we want to save the world. We truly do. And I feel like everyone here, they are so awesome. Like they really are. And I'm not just saying that because I'm saying that, but they really are. Collectively, they are the best group of people. And it's not just the clinicians, it's everyone that works with us, truly. And I think because of that, I notice that people, like, they want to go above and beyond, but they have this idea of perfectionism. So they're so afraid of doing something wrong. And I'm like, no, you're doing great. So it's everyone. You too.
Oh, thank you. It's funny that you say that, because that's kind of what you were mentioning on our last episode, was how sometimes people during like performance reviews are like, oh my God, am I getting fired? And it's like, no, we just want to shout you out and say you've been doing a good job.
You're not allowed to say, hey, could we talk for a second? People panic. And I get it. I mean, I've been in this field long enough to know that when your supervisor says like, hey, it's automatic, like, oh God, what did I do? So I get it. And I'm sure that's not just this field. It's probably any field where when a supervisor or someone in charge says, hey, could we talk? But yeah, it's sad.
There's definitely been times where I've heard either a supervisor or even people like supervisors have said to me like, oh, hey, like at 2:00, can we talk? And it's like 10 a.m., 9 a.m. And I'm like, okay, I have 5 hours to sit with this. And then immediately you see it on my face and I'm like, it's nothing bad. It's good. We just want to. And I'm like, okay, all right. I feel better now. Thanks for validation. But why would you say that it's so easy to overlook anxiety or depression and people who seem successful, put together, are really busy?
I think it's because people normalize these things, especially anxiety, right? Like some people, with like type A personalities, right? Where they're, on top of everything, getting things done, very organized. That's anxiety. It's a form of anxiety, right? And so I think people look at that and go, wow, like she's so organized or he's so organized or they're so organized. They get everything done, right? Yeah, that's because they can't go to sleep at night. Like they don't see the other side of it. They don't see what's behind it. And I use the example of me, right? Like people always say to me, how do you do all these things? I don't sleep. These IVECs, they have their own designer. And that's because I have anxiety, right? And I've openly shared that. I suffer from OCD. And so I do go through these things, right? So for me, I get it. And it looks like on the outside, sometimes I have it together. I don't.
Fun fact, I don't think anyone actually does.
No, right? Like, I don't, I have lists for my lists, like, and it's just, but that's, I think, why people think that people are so organized. I think about, or not just organized, but, together. I always think about Kate Spade and it always would bother me. How people, like, she ran with her husband, this conglomerate, right? And no one knew she suffered. She had severe depression. And then one day it was like, that was it, right? And this poor woman ran this company, did everything. Everyone idolized her, like her staff. Like there was nobody that like hated her essentially from like, well, I'm sure there is, but you know what I mean? But like, when people were interviewing them and talking to people, like everyone had wonderful things to say. And it was like, no one knew.
All of you guys had all these things to say, but
no one knew. So it's sad. It's like, you don't truly realize what someone's going through essentially. So it might look like someone has it together, but they probably don't. And no one really does.
So all that being said, what would you say are some signs that someone might be struggling internally, even if they're just going through the motions just fine?
I think if someone is acting a little bit differently than normal, like, if they're maybe a little bit more withdrawn or not as like bubbly and friendly or outgoing, or if maybe they're a little bit more snippy, like I know when I'm anxious, I'm snappy. I call it sassy, but it's snappy. Or I just kind of stick to myself. Those are the kind of things. Or if you notice like a big dip in like their demeanor or their work ethic or their work, if they're calling out more, those are the things that you would kind of notice.
So with the high functioning anxiety and high functioning depression that we were talking about, someone was going through something, they came to session, they explained everything, and they were kind of like, but I just shouldn't be feeling this way, and everything's good in my life. Like, why am I here feeling this way when everything's perfect, quote unquote?
Who created the shoulds? That's my favorite thing to say to people. Who are these shoulds and who created them, right? Like, because at the end of the day, I should be a gazillionaire and save the world, right? Who's creating that, right? Like, there is no, you create your environment. You create this. You put out what you could. So if you're saying that, like, I should be okay, so how can we get you to be okay? What does that look like for you? Let's identify the things that you think are troubling you in this moment so that we can get you to where you need to be. Because these shoulds are just...
Who's saying it? Is it society? Is it your parents? Is it your partner?
Right.
Who is it?
Yeah.
I think that's something so important to like recognize, okay, I'm having anxiety about perfect example. Maybe you had anxiety about submitting your taxes on time.
Oh, yeah.
Who's saying that you should do that? Now, granted, you can totally not file your taxes, but the IRS may come after you. So that's why you should be doing that. But I think there's definitely certain things to think about that in the exact moment, especially when you're feeling that rush of anxiety. Sometimes it feels like the end of the world. And you're I don't know how I'm going to survive, or I don't know how I'm going to get past this.
Yeah.
So if someone is experiencing all of these things, what are some small ways that we can make sure that we're checking in with ourselves or the people around us, even when everything seems okay on the surface?
I think it depends on the situation, but some of the things that I like to do with the people that I work with is kind of just say, okay, so let's create a list of these shoulds. And let's, on one side, we put the shoulds, and on the other side, how can we get to those things? What does that look like? Is that important to me? Is that important to others? Do I really need this? Is this something that's going to change my life? I was working with someone who was like, I should be going to, grad school. I should be doing these things. Okay, but why? And we went through it, right? And it was, one side was, these are the reasons. And the other side was, what is that decision going to do for me moving forward? And when she did that, she looked at me, she's like, it's not really going to change much. My parents are just going to be excited. And I thought, okay, so what does that do for you? And she decided she didn't want to go back to school. She wanted to do a trade instead. So now she's doing something else because that was what was important to her. Going to school and getting a degree and being in debt wasn't important, but doing what she was doing was important to her. So the idea of the shoulds, right? That's just an example of how.
And just breaking it down to the basics. I love how you phrased it as, what is your end goal and what do you need to do to get there? So another example is, I have been looking at my steps lately, my daily steps, and I probably walk on average 2,000 steps a day. That is terrible.
Well, you do a job where you're sitting at a desk. It's hard.
So I was talking to my therapist about it, and I was like, okay, I need to get 10,000 steps. I need to. And, I told you when I first started seeing you that I wanted to work out and all these things. And she was like, okay, well, whoa. And I was like, well, what do you mean? What do you mean? She's like, let's dial it down. She goes, how about we start with 5,000 steps? And I was like, okay. And the past couple of days this week, I've reached 7,000. And I'm like, amazing. Wow. I'm like, you've reached over that goal and you feel great when you do that. Yeah. So it's like making sure that also the goals that you're picking are realistic for you.
Yeah. They have to be attainable. You can't, I used to say to people, oh, I'm going to lose 500 pounds, right? That's not attainable. Okay, first of all, I don't weigh 500 pounds. But, if I did, no harm, no foul. I don't know. But, right, that was always my thing. I'm going to lose this amount. And it was so ridiculous, the number, also not healthy, that it was just ridiculous. And then what happens when you don't reach the goal? You're like, oh, and then
I shouldn't have done this.
Right. And then you just go into a negative cycle. So I love that your therapist said, let's do attainable goals. Because also, no.
It's not going to happen. It's not going to all be changed overnight.
No.
So you gave us a lot of advice on how we can handle our mental health, but what about you guys? You are constantly supporting others all day long. How do you take care of your own mental health?
Personally, I go to therapy as well. I think every therapist should have a therapist just to kind of process the things that we hear. Sometimes it's very heavy and we're holding heavy things for other people. So not that we're going to therapy and talking about, oh, this client here said this, right? HIPAA. But what we are doing is kind of just saying, I've held space for 15 people this week and it was a lot. And then just processing how we feel about holding that space. I also think self-care is huge. Go for a massage, get your hair done, take a walk, go to the gym, make a smoothie, do one of your favorite hobbies. I'm obsessed with cricketing, as you know. Cricket when I want to, get some self-care in, right? These are the things that are so important because without that, you're giving from an empty cup. And I know that we said that yesterday, but I always use the example of like when you're on an airplane and they say to put your oxygen on mask first, right? You can't do that if you're putting on everyone else's mask. Like you have to put yourself first. And yeah, and then you can help, because otherwise you're not helpful.
100%. And what would you say are non-negotiables for you practicing self-care?
I think for me, I don't always practice self-care, so non-negotiable is hard. But I think at least once a week, like I have to say to no, you have to do this at least once a week. Like it's not an option. And I make sure that I go to therapy every week. Like that's not I make sure everything I do is like a hard stop at that time, because I know that's important to me. So I just prioritize the things that are truly important to me as much as I can.
So this kind of goes into what you just said, but do you ever struggle taking your own advice when it comes to mental health, and what helps you stay grounded?
I think what helps me stay grounded is just kind of reminding myself that, like, again, I have to put my mask on first to help others, right? And for me, my identity is helping others. That's just who I am. It's always who I've been. You know, I was the kid that was picking up, the bugs and putting them down and like, making sure they had a blanket and a pillow. It's just always me. Like I'm always that person. And so I like being the healer. And so I know that I have to heal myself. So it's just daily reminders of, like, on my mirror in my bathroom, it says like, you are strong, you are great, you are a good person. And it says like other things, but like, it's just those daily mantras of like reminding yourself that like, you're human, you are a good person, and just do the things that you have to do for you.
So I want to ask you something, and it's clear, obviously, as a founder and a CEO of a business, it's definitely a lot in terms of the day-to-day. But if you could go back and give your younger self one piece of mental health advice, what would it be?
It's going to be okay. Because I think for a really long time, I struggled with anxiety, not knowing who I was, self-esteem. I had no self-worth. I struggled a lot. And I didn't know that I was struggling a lot, but just telling myself that it's going to be okay, I think would be huge.
And what's one message you would want to leave the listeners with as we all recognize Mental Health Awareness Month?
It's okay to ask for help. You're not alone ever. It's okay to reach out. It's okay to say, hey, can we talk? It doesn't have to be, I need help. You don't have to say, I need help. You could just say, can we talk? It's okay. You're not alone ever. You matter. And what you have to say is important.
Well, thank you. Thank you so much for coming on. And for the listeners who are listening in, thank you so much for tuning in. Remember, mental health isn't just a topic for 1 month. It's an everyday journey, and you're never alone. Be kind to your mind, check in with yourself, and we'll catch you next time on More Than a Therapy Couch.